Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hematuria can be due to glomerular disease and non-glomerular disease. Hematuria due to glomerular or renal cause. In glomerular cause or renal cause, there will be presence of both hematuria with proteinuria are seen in glomerular or renal causes. Then, glomerular cause of hematuria. In glomerular cause of hematuria can be of two types. One, we have isolated hematuria. Second, glomerulonephritis. In isolated hematuria, there is IgA nephropathy, thin basement membrane disease, and familial nephropathies are important in isolated hematuria. And glomerular nephritis is also seen in glomerular cause of hematuria. Then we have isolated hematuria. In the isolated hematuria, has already said there are IgA nephropathy, thin basement membrane disease, and familial nephropathy are the causes of isolated hematuria. So these are mainly glomerular causes. Then we also have other causes like carcinoma, especially renal cell carcinoma, or the transitional carcinoma can result in hematuria. And we have cystic diseases. In the cystic diseases, polycystic disease, or we have medullary sponge disease. So all this can result in hematuria. Then these are the renal causes. Then we have extra renal causes or non-neurological causes. The non-neurological causes of hematuria are, here we have urological malignancies, nephrolithiasis. There can be urological malignancies, any type of urological malignancies, urinary bladder carcinoma, prostate carcinoma. So in any type of ureteric carcinoma, urothelial carcinoma, in all of them, there can be kidney stones. If there is cystic renal disease, papillary necrosis, metabolic abnormalities like hypercalciuria and also hyperuricosuria, urinary tract infections, cystitis including viral or hemorrhagic cystitis, all these are also the causes of isolated hematuria, that is without the proteinuria. There is only isolated hematuria is present. Then we also have extrarenal causes. In the extrarenal causes, it can be due to the already 1 minute. I think we have said all these. Okay. In extrarenal causes, already caliculi like urinary bladder caliculi are one of the extrarenal causes. Then we have infections can occur. Then neoplasms can occur, especially urinary neoplasms, urinary bladder neoplasms, trauma, prostatitis, urethritis, and one more. In the bladder, sometimes catheterization of the bladder can cause hematuria, or it or hematuria can also occur due to the post-cyclophosphamide use. Post-cyclophosphamide use can also cause extrarenal hematuria. So all these are extrarenal hematuria. Then we also have systemic conditions. There are some systemic causes of hematuria. In the systemic causes of hematuria, we have systemic causes of hematuria. In the systemic causes of hematuria, we have coagulation disorders are present. Then we have sickle cell trait or diseases can cause hematuria, or vasculitis can cause hematuria. Then we have recurrent causes of hematuria, that is recurrent hematuria. Recurrent hematuria is mainly seen in IgA nephropathy. You see recurrent hematuria. Recurrent hematuria can be seen in Alport syndrome. Tumors can cause recurrent hematuria, or autosomal dominant polycystic kidney disease can result in recurrent hematuria. Then we also have, in some cases, urine will darken on standing. Urine darkens on standing in certain cases. Urine darkens on standing on porphyria. it darkens on standing or melanoma, and on alkaptonuria it will darken on standing and it looks as though it is there is a hematuria. So that is one thing which should be seen.
Thank you, and thank you for watching.